We are also live streaming on Africa CDC YouTube page.
Okay.
10 seconds. 7, 6, 5, 4, 3, 2.
Hello, good morning. Those of you who are watching us from Africa and from throughout the world. Welcome to our press briefing that we hold every Thursday at 11 a.m. East African time. Welcome especially to those of you who are watching us on our Blue Jeans channel, those who are watching us on our AU live streaming service, as well as those of you who are joining us from YouTube. Thank you very much for being with us today. As usual, we are discussing about the COVID situation, and in particular, the situation that pertains on our continent, Africa. And I'm joined by the director of the Africa CDC, Dr. John Kengasong. And I'll hand over to him for his brief, after which we will then go into the Q&A session. Dr. John.
Good morning, everyone, and good morning, Wayne. So today we'll do our standing press conference, and I would like to once more acknowledge the extremely important cooperation and collaboration that we are having with the media as we fight this dangerous enemy, and what others have described as an invisible dangerous enemy, which I totally agree. We need all of you to beat this beast. We must beat this beast in order for the continent to survive. It's truly a beast because of if we see what is going on in the whole world and what potentially is happening in Africa, I think it completely concerns all of us and scares us. Let me first of all start by acknowledging the healthcare workers and the volunteers that are providing services across the continent, sometimes under very challenging situations. And we must continue to put them in our thoughts and support them and protect them. These are the people that are protecting us, and we need to protect them and support them all the time. I will then, as usual, break my comments into several parts. First, we'll start with an epidemiological situation. As of 9 a.m. East African time today, the world has passed that threshold of 5 million people infected globally, with about 320,000 deaths, unfortunately. Who could have imagined in December, when we break off for the end of year holidays, that just 5 months later, 5 million people will be infected by an unknown virus, which was then. In Africa, 54 African countries have reported 95,000 cases of COVID-19. Of these numbers, about 3,000 have died, giving a fatality rate of 3.2%. The good news is that, which we must celebrate, is that of these number, 38,000 have recovered. Since the last briefing, which was on May the 14th to May the 20th, which is today, we've recorded 21,677 new cases of COVID-19 infections. This number compares to about 20,771 cases that were recorded between the week of May 7 and May 13. This is about the same number of cases reported this week compared to the previous week. The average daily of new cases, and this is very important, is about 3,000 per day. So in other words, between last week and this week, we may not have seen a very large number of significant changes there. We hope that trend continues, but we will see what happens. But if you look at the regions very carefully, the 5 geographic regions of Africa this week, the following can be said. Southern Africa counted about 6,000 new cases, precisely 6,400 new cases, followed by North Africa with about 5,400 new cases. West Africa, about 4,600 new cases. 500 in Central Africa and 2,600 from East Africa. So the regions are affected very differently. And even if you look at the individual countries within each region, the variation is also very significant. If you take Southern Africa, for example, in Southern Africa are driven by South Africa. I think that we should always look at the global picture, the regional picture, then the granularity within each region. The 5 countries with the highest cumulative number of cases are South Africa with 18,000 cases, Egypt with 14,229 cases, Algeria with 7,542 cases, Morocco with 7,133 cases, Nigeria with 6,677 cases. These countries account for 56% of all cases reported on the continent. Countries reporting the highest number of cases per 100,000 population include Djibouti, Sao Tome and Principe, Gabon, Cape Verde, and Guinea-Bissau. Sahrawi Democratic Republic is still the only country in Africa without cases after Lesotho reported their first case last week. Let me now transition to giving you some updates on what Africa CDC continues to do. If you recalled a few weeks ago, about 5 weeks ago, we did launch an initiative called Partnership to Accelerate COVID Testing in Africa, which was underpinned by ability to test, to track, to trace, and to treat. At that time, the testing on the continent was around, the total number of testing on the continent was around 400,000. And we set ourselves a target that we wanted to get to 1 million tests that is Africa CDC would distribute an additional 1 million tests in the coming weeks that followed then. I'm very pleased today to announce that Africa CDC since then has distributed exactly 987,750 tests from different sources, including 282,150 tests from the Tibor mobile supplies from Senegal, so getting it from Germany and shipping it to Senegal and distributing it from there, and an additional 205,600 test kits that were subsequently shipped just last week. And as we speak today, we are distributing rapidly 500,000 tests across the continent, which is thanks to the collaboration we have with the Jack Ma Foundation. So we came very, very close to hitting that 1 million target that we set for ourselves. In the coming weeks, we'll continue to intensify that effort and build up more partnerships to now reach our next target. The next target of getting 10 million to 15 million tests across the continent. And the key word here is partnership. I just want to go on the record that we are not saying the 10 million to 15 million is what Africa CDC will provide, but what we can do collectively as partners coming together with donors to get countries to that level, which will begin to increase our ratio per million tests for the continent. We have since launched a campaign in partnership with Facebook focusing on hand and respiratory hygiene and laboratory tests for COVID-19. In the area of trainings, we continue to do active trainings to support our member states. One of those is a clinical community practice training of 320 participants from 54 member states, which was entitled Maintaining Critical Care Services and maintaining maternal and pediatric services. We know that our whole maternal child programs tend to suffer a lot during severe disruption. So we continue to provide training in that space. The second area of training that we've provided is entitled Environmental Cleaning for about 420 participants from 48 member states of the African Union. We've also trained 620 participants on best practices in implementing structured, quality-assured COVID-19 testing program. Very important. It's good that we focus on quantity, but also focus on quality. We also inaugurated the Risk Communication Community of Practice and held the first training on risk communication for more than 60 journalists that are reporting on COVID-19. And we trained 630 participants from more than 45 African Union member states on the role of surveillance in identifying cases for targeted testing. This is all part of the PAC initiative, again, the partnership to accelerate COVID testing. And lastly, we've provided training to 320 participants on clinical community of practice to discuss continued provision of essential healthcare services during the COVID pandemic. I'd just like to end by saying that we, in order to unlock the supply chain management process, a platform is being developed which, in partnership with the private sector, that would allow centralization and pooling of response commodities. And we hope that that platform will go live in the next 1 week or 2 weeks, which will allow us as a continent to continue to coordinate our supplies and commodity needs, and then help countries to achieve that. Let me just end there at this point and then give it back to Wayne.
Thank you very much, John. That was a very comprehensive brief of the situation that pertains in Africa at the moment. So we're heading straight into your questions. We have about 30 minutes for this Q&A session. And we will start with a question from Julia of Reuters. Some countries seem to be putting more precautions in place and doing more testing than others. We are seeing a lot of cross-border transmissions, like in southern and northern Kenya, for example, and other places. Is this a worry? Julia has a second question. Tanzania lifted entry quarantine and claims cases are dropping. Is this information accurate? Do you get any data from the government? Those two are from Julia of Reuters.
Thank you, Julia. And cross-border issues are of particular interest and concern to us. And it's not the first time that we are dealing with cross-border issues. If you recall, during the Ebola outbreak in DRC, in Goma, together with Commissioner Amira, Dr. Moeti, from WHO, Afro, and the ministers, 10 countries came together in Goma and agreed to establish a framework of coordination for cross-border surveillance and intervention. And I think that is an area that is an evolving area of concern. We will be focusing on that very deliberately in the coming weeks as we learn more about these transmission patterns there. But I'm very pleased that the regional economic blocs are taking a lead on that. Just last week, as you recall, the East African community at the highest leadership level, at the level of the presidents, met to discuss issues related to cross-border related issues for COVID-19. With respect to Tanzania, we are still learning more what is coming up of Tanzania, but we have not received further information from Tanzania, but we are actively engaged with the authorities there, and we do not have any reason to believe that at this point they will not cooperate. The opinion of the joint continental strategy, which all of us as a continent agreed and endorsed, and it was finally approved at the highest leadership of the continent, is that we must cooperate, we must collaborate, we must coordinate, and we must communicate. So I think we are hoping that the centrality of that joint continental strategy will continue to be alive as we fight this very dangerous enemy.
Thank you. Can I just remind colleagues who are wishing to ask questions to please send them to the WhatsApp number +251 9455 02310. I'll just repeat that again, +251 9455 02310. We move on with our questions. The next one is from Cara Anna, and she's with AP. As more countries around, do you think they will be more or less inclined to help pandemic and its painful economic effects, and why?
So take on that one.
I'll take that again.
Yeah. No,
As more
you
countries,
want me to respond to that immediately?
Yes, please.
Okay.
There's just
sure.
the one from
I
Cara.
got a question. Very, very good question. I think more and more the more we see countries in the West that were initially first affected beginning to ease down and get to what, in quote unquote, what I call no mercy, the more that Africa stands a good chance of being better supported. Remember, on this same forum, all for international solidarity, that this is a global crisis that requires a global solution. There is absolutely no way that the world will be safe if the continent of Africa becomes the next epicenter for COVID-19, and especially that is sustained. I mean, that will continue to be extremely challenging for us to live in a world where 1.3 billion COVID is circulating around. So we expect that there will be more cooperation and solidarity for Africa to be supported. And a committee of foreign affairs of the French Senate, and we plan to do the same with the British Parliament and also a committee of the US Congress. I can only interpret that as a strong interest from these industrialized and Western countries to begin to understand more what is going on and how they can support Africa as a family in the same family in the planet.
Okay. We have one question from Pamela French, and she's with Channel Africa. Some countries struggle to contain contamination rates, and she gives an example of South Africa.
I think South Africa continues to test more. And if you test more, you find more. The most important thing is we are encouraging countries is there's only one winning formula to fight COVID-19. The formula is through the PAC initiative, which is ability to test, to trace the people and isolate those that are positive, and then repeat this all over again. That is the winning formula. We do not have a vaccine for this, so we cannot say that we shared experience on vaccines. We do not have drugs. So we are using the traditional age-old public health practice, which is the testing, the tracking, and the tracing strategy. That absolutely will be a fatal mistake that we'll be making, and that is the winning formula there. Now, South Africa and many all countries in Africa must intensify their ability to scale up testing, but not do that in isolation, and improve the turnaround time of the test, so that people who are tested and test positive can actually be isolated quickly and their contacts identified. If you do not do that quickly, then then a given infected individual continue to be in touch with a larger segment. If you test, you must find the people that were in contact, and the only way you do that is to deploy large amount of community workers to support that applied just that. Did the intensive, aggressive testing, tracking, and tracing strategy, and for the last couple of many days, they've gone without cases there. I know that if you unpack the epidemiology on the continent, you see many countries that are they're having very, very limited increase in number of cases because they are intensifying that the ability to test, to trace, and to track patients.
Sonia Beard from the African Exponent has two questions. While China is a chief commercial partner with African nations, many of the infections were imported from Europe. Did China take any specific measures in January or February to prevent the disease from spreading to the continent? The second question, what is an ideal positivity rate for a number of tests conducted?
We live in a world that is globalized, and you're absolutely right. When we were preparing the continent, I mean, we didn't leave the continent in the hands of anybody else to prepare us. We prepared the continent against what we are dealing with. And as early as the first week of February, where we had no cases of COVID-19, we started a very aggressive approach to scale up diagnostics. We pulled people into Senegal, 16 countries to be very specific, train them on the diagnostics of COVID, what we call competency-based. What we did was to select countries that, at that time, if you all recall the history of this, there were still flights, a lot of flights from the continent of Africa to China. Then, on the 14th of February, the first cases of COVID hit the continent in Egypt and subsequently Nigeria. And thereafter, we had a massive importation of COVID, but it all came from Europe, not affected than we thought. And I think that is a very, very important lesson that we should learn, that a disease outbreak anywhere in the world will be a threat everywhere in the world. So we have to really come together and strengthen our health systems and to dictate that and take health security as important as economic security. Our target should be that we, as a continent, we should strive to test at least 1% of the population. If we go with that number, testing 1% of 1.3 billion people means we need to have tested 13 million people on the continent. But as we speak, we have tested about 1.3 to 1.4 million people or positive.
Emmanuel Igunza from the BBC. I have a question to follow up on what Dr. John has version of attention and funds to COVID-19. How big is this problem and what regions are more affected? He has a second question. We have seen several modeling or projections in other regions like the US and Europe. What projections does the...
On this conversation. First of all, we know from experience that any disease outbreak of this magnitude creates significant disruption to maternal child health programs, including immunization. We also know from the history of pandemics or massive outbreaks that they also disrupt our traditional vertical programs, i.e. TB, malaria, and HIV. We should always remember that a combination of those three kills about 1.2 million Africans a year. Immunization programs. The reason that we are pushing forward with that campaign is to ensure that deaths do not occur from COVID rather than because of COVID, which is a very different scenario. In West Africa, so many people don't go to the clinics to pick their HIV drugs or their TB drugs, so it creates a lot of problems there. That's why that campaign of do no harm to this, limit harm. The first pillar is to limit transmission, the second pillar is to limit deaths, and then the third pillar is to limit harm. We do not yet, Emmanuel, will collect, and we continue to collect in partnership with the ministries. Our immediate focus, as you know, is to put off the fire that is burning us now, which is the COVID-19. And of course, with the right partnerships with the countries, we'll continue to get that very critical information. On modeling, I mean, Africa CDC has a team of about 300,000 deaths in Africa. I mean, Africa CDC has taken an exception in focusing on modeling. Rather, we're taking our focus has been to intensify our response strategy. That's why the PAT effort is so important. The partnership to accelerate testing and testing, tracing, tracking, and treatment is so important. Countries locked down very early, and that delayed the pandemic. But I really want to be sure that we understand that it doesn't mean that Africa has been spared with this. As we speak today, as I mentioned, our numbers continue to increase, not decrease. So I think the modeling is only as good as the assumptions that you put into them. Every time we will be putting out numbers that are actually informed and meaningful based on critical assumptions.
We have a question from South Africa, and this one is from Vic, and he's with the BBC News. The health minister in South Africa announced last night that a 2-day-old baby became the youngest victim of coronavirus in South Africa after being born prematurely to a coronavirus-positive mother. It is the country's first neonatal death. I wanted to find out whether this is the first such case on the continent that the Africa CDC may be aware of, or has any comment, or if you have any comment pertaining to the above.
So that's a very, very, very good question. Let me say this before I go to address the question. We are dealing with a new virus. We should remember that. And that we are learning every day. We've lived with this virus on the continent just under 4 months. I mean, if I take February 14 as the time that virus showed up in Egypt, and today, I mean, so I think we are. It looks like we've lived with this virus for 4 years because of the massive number of information that we have accumulated. But we're still learning and still needs to learn more about this virus. We continue to see the spectrum of the virus, the clinical spectrum of the virus, or learn more about it, and which or cannot affect. We continue to learn from outside the continent how infants or children are affected. Just last week, if you recall, we were dealing with the Kawasaki syndrome or cases, which we will be putting out an alert to all ministers of health this week. And now there's this case of the case that you just described. So we continue to learn from the virus in terms of how long, after infection would the side effects remain. We don't know issues related to co-infection of the virus. We truly don't know about how to increase the ability to share data and information so that we can analyze and make recommendations that are specific for the continent based on data that is generated from the continent and not extrapolating data from outside the continent for our own control and management measures there. So to the best of our knowledge, that is the first case that Africa CDC is aware of.
This question, the next one, comes from Della Russell, and she's with the Daily Graphic in Ghana. What is the status of the funds to support its activities?
No, thank you. I mean, since the fund was established, and there's a lot of excitement to it, and countries and others continue to contribute to the fund. And we, as Africa CDC, we've submitted clearly a work plan to access the fund. And yesterday, my understanding yesterday, I wasn't a part of the meeting yesterday because I was on leave, is that that plan is approved and will in the coming days be accessing the funds that are available in there. But the excitement around the fund is really, really huge. And the support of the governing, the board of the fund is also very, very strong.
Sarah Jerving with DevEx. Can you talk about efforts to increase the capacity of researchers across the continent to genome sequence the variant? Third question, what countries is this research primarily occurring in? And then the last question, what are the implications for the continent as a result of low levels of genome sequencing of the virus in terms of future vaccines and treatments?
Very, very good questions. I mean, all set of questions are great. I mean, before the COVID outbreak and subsequently the pandemic, the Africa Centers for Disease Control, first week of December, with a goal to create a network across the entire continent, and about 20 centers or institutions, laboratories were accessed and then all link up into this network. So as we speak, we are using members of this the network to slip from anyone to participate in that. There are already networks on the continent that established networks that are active in research, clinical research. The Pandora network, which is supported by the European Developing Countries Clinical Trials Platform, commonly known as EDCTP, is active, doing some of the clinical research work. And the notion that Africa should expect vaccines or clinical products from clinical trial is not appropriate. Africans are extremely competent and have demonstrated this over and over in the ability to conduct clinical trials and including vaccines. We just recently, we know what done in the DRC when they did the clinical trials for monoclonal antibodies against Ebola, which is a game changer in that effort. During the West Africa Ebola outbreak, Africans led the research on vaccine clinical trials. So I think the continent has very capable expertise to do clinical research and vaccine trials. They just need to be empowered to do that. And that's where partnership should be. A partnership with African scientists cannot be a top-down partnership, but it should be a partnership that is based on equality of contribution.
Our next question is from David. David doesn't give us the institution that he's with, but his question: we are still at the start of this pandemic in Africa. What is the worst case scenario that you're looking at? I talked to modelers who were suggesting an alarming potential 60 to 90% infection rate with 0.3% fatality rate. Is this too pessimistic or alarmist, or your worst case scenario too?
That is, David, thanks for participating in this news conference. The number, we've seen all kinds of numbers, and that's why, again, I'm very reluctant to put out numbers there, but what you just presented would be the worst case scenario. If we had gone with projections that were put out in January, and projections were as following. They said some projections showed that countries like Kenya, before Easter, would have recorded about 20,000 to 50,000 cases of COVID-19. That is not the case. Kenya, as we speak today, is still maybe under 1,000 cases there. We live also with the assumption and understanding that we may not be seeing all the cases because of our limited testing, but we also are encouraged that we are not seeing a lot of community deaths happening. If that was happening, we will pick those up and actually know that there are clusters of this happening and people are dying. We are not also seeing a massive flooding of our hospitals. Massive flooding of our hospitals because of COVID infected patients. So we are encouraged with that. So back to the modeling question is that, yes, the worst case scenario would be where we're seeing more than 3 million people infected with about 300,000 deaths, as we've seen in some numbers that have been put out in the literature. And that will be overwhelming for sure for the continent because our health systems are weak. I mean, you do not build health systems when you need them. You build health systems before you need them. That is known, and there is not much you can do if you are overwhelmed with such large numbers of patients. Yesterday, I was following news in Brazil where they are converting a stadium to hospital settings where they can use to accommodate patients. I think it will always be a challenge if we are flooded with a large number of cases there. And that's why we're really calling for this partnership, for the world to take our PAC initiative seriously. That is the winning formula. That is what is going to help us fight, put a strong fight against this virus, rather than wait for people to go be admitted in the hospitals. No matter how hard it is, we must test, we must track, we must trace people.
All right. Let me just go to our next question. And this one is coming from Robbie from AFP. South Sudan has seen a very steep increase in cases in recent days, and the positivity rate is very high. What specific challenges does South Sudan face, and what support is Africa CDC providing?
Africa CDC has been providing support across the board, I mean, including for testing, including for deploying responders, I think, and of course, training. The challenge that countries have across the continent will differ. So as we know, Africa is not a country, it's a continent, and which means we are at very different levels of competencies and capabilities and human resources for health on the continent. A country like Sudan, South Sudan, that is emerging from instability and conflicts will definitely be challenged because you don't have the appropriate right human or a sufficient human resources for health. I mean, clearly that is the case. We are also seeing rapidly evolving cases in Somalia that is extremely worrying because when we started this conversation this morning, I stated that Africa would not be free of COVID if we have COVID in any African country. So what is going on in South Sudan is very concerning. What is going on in Somalia is very concerning because of the nature of the political nature of the countries and because of their unique situation where they are coming from. But Africa CDC has been providing training. Some of the numbers that are listed here include people that we've trained from those countries. And we are also ready to deploy community workers to support their PAC strategy, which is the ability to test, trace, and treat patients.
Thank you very much. Let's go to those who are joining us directly, live. We have Peter Fabricius of the Daily Maverick. Peter? Peter? All right.
Can you hear me now?
Yes, we can hear you, Peter. Please go ahead. Yes, we can hear you.
Sorry, I was switched off. Yeah, Dr. John, just wanted to check the money that was promised by the G20 to Africa, including debt relief, has any of that actually sort of kicked in? I mean, is it having any material impact? And if, on the fight against COVID-19, and also, if I may ask, relating to the so-called remedy that Madagascar has produced. You told us last week that you were collaborating with the Malagasy scientists. Has anything come of that? Has it been tested yet? And Tanzania, is Tanzania now providing you with up-to-date information? It's stopped putting out figures. I just wondered if that has changed. Thank you.
So all very good questions. The G20 discussion and promises. We have a meeting actually scheduled for next week with a joint meeting that the Commission is proposing between the Ministers of Finances and Ministers of Health, so that we can really understand, get the two governmental departments to have a conversation as to what is actually available and what is it that we can do to tap into that for the response collectively, not just at an individual level. I think we, from the health angle or dimension, will be making a case that whatever is raised, if the continent finally raises, say, $100 billion, that 10% of that should go to strengthening our health systems. I mean, I always make the point that you start off, when you have your kitchen sink leaking, you really want to turn off the tap first before you clean the floor. So the tap is the COVID-19. So you need to find monies to block that tap so that we can now clean our floor safely, which is the economy. So that is a conversation that I like to have with the joint meetings of Ministers of Health and Ministers of Finance. That way there's total transparency as to what is available, and next time I can give you exact numbers. There's concerning Madagascar, I want to be very clear that there's good dialogue going on between Madagascar and the Africa CDC and the African Union Commission. And we've made sure that we do not make this us versus them, but rather we make this clearly that it is a partnership that we want to establish to see what is actually behind this remedy. The Foreign Ministry wrote to us agreeing that they will submit us with the data. We are still waiting to get the data transmitted. We will follow up with a reminder because this is urgent. Because what if something good was in there, then it will be very important that we work with them to scale it up very, very quickly. But the two things that we always insist is that any remedy, like the things that we all take for our own health, it should be safe. And it should really show that data that it is efficacious there. So those are the two things we are going to be looking for. But we consider that we remain hopeful that in the coming days, they will reach out to us. Tanzania, as I said earlier today, we expect that as a member state, Tanzania continue to adhere with the joint continental strategy that has been endorsed, underpinned by effective communication, which means sharing of data, effective cooperation, which means we are in this together and we have to cooperate, expecting that Tanzania as a member state would adhere fully to the principles of the joint continental strategy.
Thank you very much, John. We have a number of questions still to go, so perhaps we'll give a little bit extra time, maybe 10 minutes, so that we can try to mop up these questions. Claire Keaton of South Africa's Sunday Times. What is the continent's shortfall of PPE? What are the plans to ramp up supplies? And then on nursing, are there any plans to train or increase nursing staff for this pandemic?
So the plan for PPE is simple. The platform approach that I highlighted, which I referred to earlier on in the discussion, which this is a common platform that would be like shopping online, like the online platforms that we have, be it Alibaba, Amazon, or the one that the continent uses there. So we are very advanced in that. We are hoping that that platform will not only offer diagnostics, but it will also provide for other personal protective equipment and begin to unease that supply chain process from everywhere in the world, whether the producers are in the United States or Europe or Asia, China. I mean, everybody wants to be. That will ensure that we have transparency. That will also allow us to have a predictable supply of these commodities to respond to COVID-19. With respect to nurses, as I said, workforce development is an integral part of health system strengthening. And in as much as countries would like to scale up, their nursing pool, we all know that, it takes time to train a competent healthcare workforce. And that is what we are saying that, when this is all over, we need to have a very focused discussion on what the continent needs to do to ramp up speedily its workforce for health agenda. Clearly, we cannot keep using the same formulas that we've used. We've now recognized that the central component of our health system strengthening is public health workforce, and we are completely in short supply of those.
Omar from Reuters. Some countries are starting to open up, for example, Tanzania, while others are still under lockdown. How does that then complicate your approach to mitigating the outbreak?
We have issued guidance called on easing the lockdown, which, as we speak, this week will be going out. It has been vetted by the coordinating committee of ministers of health, just to explain in a very simple step-by-step manner of how countries should be easing the lockdown. So it's a document that we strongly will encourage that and seek your partnership, you the media, so that countries can actually understand what to do and when to ease the lockdown. Just some highlights from that. We are saying that you have to scale up your testing as much as possible. You have to increase your ability for surveillance. That is the tracking component of our PAC initiative. That you have to have your healthcare facilities ready. for increases, because there will definitely be increase in number of cases as you ease the lockdown. Clearly that, but that's not the main thing. The main thing is, are you prepared to test, find where the clusters are happening, link them, they do the surveillance with tracking, and then link those that are sick to hospital facilities. That is what is going to really help with countries, what we call the safe unlocking of the system. Secondly is that you start progressively. You don't just unlock the entire country. You start small, and then you evaluate it after 2 weeks or so on the effect, what is happening, and then you expand that to other critical services, and very progressively you get to a total unlocking of the system. So I think we strongly encourage countries to follow the guidelines that we are putting out there. We will also be extremely appreciative if the media can help us to advance that the concepts and the guidelines that we are putting out there to enable countries to unlock safely.
Sem Eferaro of Africa Health Times in Nigeria. Pictures from some of our isolation centers in Nigeria show people dancing, eating, and generally having a good time. Some of the people that were discharged also speak of recovery after malaria treatment and nothing more. Now, many people in the country are beginning to doubt the existence of COVID-19 here. I don't know the situation in other parts of Africa, but sir, could it be that COVID-19 is not really as serious in the continent as we are being told?
That's a very good question. And COVID-19 is a dangerous virus. It's a serious virus, and a virus that is treacherous, which means it has the ability to give you a false sense of and make you have a false sense of complacency, and then you are overwhelmed with it. I think I've always argued that public health is three things: is the pathogen, which in this case is COVID-19, is the population, and then is the policy or politics that you play with it. So a combination of those three all have to be in place. Now, in terms of population, Nigeria, % of the Nigeria population being infected, that would be extremely dangerous.
Our next question is coming from Paidamoyo Chipunza of Zimbabwe. And Paidamoyo says, it seems some countries, for example, Zimbabwe, are really lagging behind and also has its targets underpacked.
Yeah, Zimbabwe is a member state of the AU, and our targets for PAC, as I said, when we launched PAC about 4 or 5 weeks ago, the continent was under very close to 400,000 tests. That is just, to be specific, 415,000 tests. And today we are above 1.3 to 1.4 million. So we are in the right direction. I think as we unlock the supply chain process for diagnostics, in the coming weeks, we expect to see. But the most important thing, I say, is to stay faithful to the PAC strategy. If you test and you don't trace, then you just wasted the testing. Again, this is not malaria testing or HIV, where you go to get your result and you test because you care, you want to find the people that are infected, you isolate them, find their contacts, and then repeat the whole process there. That is the winning formula for this. So I think when we preach testing, we should also be preaching the ability to trace, and that is why we are calling on the continent to deploy 1 million community healthcare, at least 1 million community healthcare workers, and to support the ability to track for contacts, and then follow them up and isolate those that are positive.
Let's go back to our colleagues who are joining us live. Can I call upon David Pilling? David? David, are you able to communicate with us?
David is on mute.
All right, perhaps you could unmute your microphone. Hello, David. All right, we'll come back to you just now. Let's go on to Pamela French. This is her second question, and she's from Channel Africa. She says, I've heard about a new trend of coronavirus in China. Do we have any such trend on the continent, or are we only dealing with one?
For now, our sequencing information will teach us. I mean, as someone asked earlier about the genomic sequencing is where we are really expanding our efforts. The answer to that is that we're still analyzing viruses on the continent, and we would know in a very short time what different strains are going on the continent. And it's a very good question because it speaks to the nature of the virus we are dealing with. That these are what you call the RNA viruses. And we know that RNA viruses would tend to mutate a lot. And there's no doubt that we'll see different strains of the virus. The key, and that is important for vaccine designs and drug designs and even tests. So it's very important that as a continent, we understand the different the dynamics and the evolution of the virus on our continent. So we'll keep you posted. I think that question also ties to the other question about how many sequences have we done on the continent. I want to assure everyone on this conversation that we are carrying out extensive networking to sequence as much as possible.
To conclude our session today, let's try David again. David, are you able to talk to us?
There's a mute thing.
I can see you speaking, but we cannot hear you. Can you unmute your microphone? Oh, I'm sorry. We don't seem to be able to connect with you. Perhaps you could send your question via our WhatsApp line, and we could try and attend to it next week. So finally, Kara Anna, is any country rejecting the Africa CDC's help, and which ones? And do you find it unusual that some richer countries, including the US, seem to be having trouble with the basic work of contact tracing?
So there's no country in Africa that I know of that is rejecting Africa CDC's support. I think that is just it's a fact. I'm not sure that, to the best of our recollection, we know of any. We continue to learn. I mean, we can only speak on Africa because that is where I wake up every morning, and just like everybody at the Africa CDC, thinking of the continent, what should we be doing to be ahead of the pandemic? And as a continent of 1.3 billion people, I think that and any lessons that we can learn from anywhere will be very, very important for us as a continent. I still believe strongly so that we have a fighting chance to turn the tides against COVID-19 if we implement PAC across the continent. That again is a winning formula.
All right. Finally, before we conclude,
some key messages for Africa Day is that we can only win this battle on the continent if we express continental solidarity, first of all. Very, very important. Second is that we have to beat this beast for the continent to survive. I mean, that is just that, which means we cannot yield to this enemy. I mean, as Africa is a resilient continent, this is not the first pandemic or outbreak that we are facing. And that we will beat this beast and win the battle against this. Lastly, is that if we do not do this, we should always ask what's going to happen to our free movement of people. What is going to happen to our ability to integrate as a people? Then that is what is at stake. So, Fakib Mohammed, and with support from Commissioner Mira, I'm very optimistic that we are going to beat this beast and come out as a stronger continent.
Thank you very much. That's our last contribution for today. But we go out with an invitation for you to join us next week on Monday, Africa Day, as we celebrate some of the successes that have happened on the African continent and look at those key message items that Dr. John has outlined. And that webinar will take place at 6 p.m. East African time. I believe that that is 3 p.m. GMT. So join us again next week on Monday. But as usual, we'll be back with you on Thursday for our regular press briefing. Thank you so much for joining us. Are we off, Anne?